Welcome to the Art of Prevention podcast. I'm Dr. Nick, and today we have a very special guest, Dr. Taylor Premer. And Taylor, you've been a longtime inspiration for me from when I was in school to now being a practicing chiropractic physician. And you have a pretty interesting background getting into the chiropractic profession. So you grew up in Nebraska.
That's right.
You played all of the sports, basically, it seems
right.
like. Me, I played one sport, and they were like, you got to play this sport, and that's it. You were wrestling, golf, football, spanning the whole gamut of, or the whole array of sports, if you will.
That's right.
You had a couple of injuries during that time, and some of those injuries were related not only to impact injuries and musculoskeletal system, but also from nutritional injuries and things like that, sort of a functional medicine issue.
That's right.
And that got you interested in nutrition, chiropractic school, and now you specialize in treating high school athletes. That's right. And you see the same vicious cycle that we see as far as you have that causative injury, and then now we've got that initial injury. What's the best predictor of subsequent injuries? That initial injury, right?
Previous, yeah.
So today we're on talking about how do we prevent this vicious cycle from starting in the first place. We're going to be giving really good advice for athletes, coaches, and then other providers as well.
Yeah,
right?
Love it.
So I'm excited to get started, and here's our podcast with Dr. Taylor Premer. Tell us a little bit about yourself. Maybe let's start, not from birth, but maybe from high school,
Yeah. Well, thank you for having me on, Nick. I appreciate it. You're one of my best friends, and cheers to some good coffee, too. So,
yeah.
Some decent coffee anyways, right? So I like you said, I grew up in a little tiny town in the middle of Nebraska, so I graduated with 30 people in my high school class. So, I mean, it was tiny, rural, and we basically didn't have great healthcare around. We're going to put it that way. So we'll put that lightly. But yeah, I loved athletics, loved sports. If my school had more sports, I would have played more sports, but I was kind of restricted to those. So, I kind of shot up in height my freshman year. I went from like 5 foot to 5'5", like literally in the span of 6 or 7 months. It was kind of crazy. And so, in that time, playing so much impact sports like football and wrestling. And then also, we were playing baseball at that time and a bunch of other things like that. I started to develop these crazy knee and heel pains. I mean, and now looking back at it, I know exactly what it was. It was Osgood-Schlatter and then Sever's disease, which are, if the listeners aren't aware, these are soft tissue deformities.
So Osgood-Schlatter's that pretty classic bump on the front of the knee.
That's
a
right.
lot of cross-country people get, a lot of runners.
Yeah.
And you were doing a lot of impact things.
That's right.
Sever's disease is an apophysitis on the heel, and you had it on both sides.
Yeah, both sides, both knees.
So 4 areas
Yes.
of just pretty debilitating pain.
Gosh. And what was crazy is it would wax and wane. It would stay on my right side and go to the left side and then the right side and then the left side.
Yeah.
And it, in Nebraska or anywhere in the Midwest during the summer, the ground is so hard, which sounds crazy, but like I remember our practice fields being so hard. They're like concrete.
Yeah.
So, and I mean, there was no turf fields around or anything like that, which is maybe a different conversation for another time. But, and I just remember after practice, oh my gosh, I would get home and I would be literally in tears to my parents.
Ice your whole body.
Yes, exactly, because that's all we knew.
4 ice packs.
4 ibuprofens.
That's it. Get that vitamin I in you, baby.
That's right. And so, and it wasn't. I don't fault my parents or anything like that. We didn't have good information. Nobody knew what the heck it was. We were going to our primary care who we loved. They were saying, oh, you got heel pain, go to the podiatrist. The podiatrist was putting these hard insoles in my shoes and then saying, go play football with these hard insoles, which was a disaster in itself. So you can imagine like the cycle here. So now once my heel started to get better, well, now I'm pounding on this hard insole in my shoe and here we go. Now my heel kicks back up again. And so long story short, I started to realize once I got into college and then finally into chiropractic school, I had some underlying genetic nutrition issues. So I've got what's called hemochromatosis, which is a genetic variation where basically my red blood cells cannot get rid of iron, but it's a inflammatory inflammatory disorder. And so then I also had genetic predisposition and celiac disease, which basically means I'm allergic to gluten. My body just rejects basically everything. And so looking back, my nutrition sucked. That was in the day of fast food. We were eating, Pop-Tarts and toaster strudels for breakfast. Lunch, I was cramming down pizza and stuff. So, I mean, looking back, I saw this vicious cycle that I was going through, up and down and wax and wane. And so anyway, that's literally what has gotten me to this point. And so now I'm in Troy, Missouri, which is just it's about 45 minutes outside of St. Louis. We're a 6A school. We're actually the 7th biggest school in Missouri, but we're very rural. So same as kind of my growing up, it's a small school, small area, not a lot of access to healthcare, poverty, a lot of people on free and reduced lunches. So it's kind of an ironic thing. I never really saw myself getting back to that, but now here I am back trying to help kids with preventing what I went through basically when I was in high school. So.
Yeah, I mean, so many of the things really resonate with me, what you said. I mean, hindsight's always 20/20, and that's really the purpose of us sitting down today is, okay, what are those things that looking back we could have changed, and now how can we provide this information to individuals that are now going through the same things? And that's so interesting how your purpose kind of circled back to going back to those high school athletes and really helping them out. And I've seen you work. You go and you volunteer your time at the high school. You're sitting on the sidelines. You're also volunteering your time at another high school. Yeah. So you're really doubling down to one of those even more rural schools with no access to athletic
Silex
trainers,
has literally nothing. They don't have an athletic trainer. They have no one that calls on them. They don't even have a school nurse. I mean, it's crazy. So when I go there, it is like a MASH hospital. I see everyone from the janitor to the junior high kids all the way to the high school. So coaches and stuff like that.
Yeah, and you are really running the gamut from MSK to their primary care to, giving kids saltine crackers when they have a stomach ache, I'm sure, right?
It's literally like that, yeah. Teaching them what electrolytes are. I mean, they don't even know.
Oh, man,
just little things like that. But I mean, it's a grind, but I love it, man.
Yeah.
Nick. And I know you have the same passion as I do. And, I get more passion and more fulfillment out of going to those small schools and actually making a difference on these kids that maybe don't have access to healthcare because their parents don't have enough money or, their insurance isn't covering those types of things. And so that's where the fulfillment comes. It's hard, don't get me wrong, but it is worth it. So
yeah, it's a grind for sure.
Yeah.
Now, let's go to that high school athlete and maybe let's, see if you had that time machine and you could go talk to young Taylor about some of the things that he could have done. What's some advice that you would give some of the young athletes, whether they be in middle school, high school, even collegiate athletes, and maybe they're experiencing some of these musculoskeletal things that may be related to poor sleep, poor nutrition, poor hydration. What the heck's an electrolyte, right?
Exactly.
I got to put these in my water. I thought water was it. That little side of Mountain Dew, right?
Right.
So what are some of the big points that we could hit as an athlete, not only to reduce injury risk, but optimize our training stimulus?
Sure.
Because at the end of the day, we want to reduce injury, but we reduce injury as a way of optimizing our performance and spending less time on the sidelines so that we can compete more, we can win more championships, more awards, and hang out more with our teammates and play and kind of go to battle, right?
Right, yeah, exactly.
So what kind of stuff would you talk about with these athletes and what kind of advice would you give?
We were talking with Brian beforehand. Probably hammering 2 donuts when you wake up in the morning isn't the greatest way to get your day started. So I think literally just understanding like carbohydrates are sugar. At the end of the day, you need carbohydrates to perform, for your brain to function, for your body to recover. But carbohydrates are made in different. The carbohydrate from a potato or a sweet potato is way different than a donut, or let's say electrolytes from even, I don't even really like to say the companies, but let's say an electrolyte from salt is much different than an electrolyte from Gatorade.
Yeah.
Okay. Like those things are different animals. And then how those play in recovery, I think is the most important. Yes, you don't want to cramp on while you're playing a game or on during practice and stuff like that, but your brain and your body needs those electrolytes and those essential nutrients in order to recover so that you feel better the next day when you wake up. Because I was in that cycle where I'd go to the weight room, I would lift wasn't ever taught how to lift, but I would lift and I would try to lift heavy weights and I'd wake up the next morning and I would feel terrible. So then my brain was like, in my head, I mean, I like to think I'm halfway smart. Like, well, that didn't feel good. So maybe I shouldn't do that again. So then I almost have this, I don't know, internal angst against working out because I remember how it made me felt. But if I were to have like someone to kind of guide me and just kind of talk about what it takes for a body to recover, then I think that my training would have been much different. So I think that would be the first thing I would do is just like just an even basic understanding of nutrition and basic understanding of what our body actually needs to function. So that would be the first one. And then I think, man, if I could have just had somebody that would have guided me through the weight room. You know, just because there's just because there's a bench there doesn't mean you got to put 45s on and bench all day long. Just because there's a squat rack doesn't mean that my little skinny, 5 foot, nothing, 100-pound person needs to put a ton of weight on my back. So, those little things. One thing I left out from my story is I have a degenerative pars defect in my spine. It's a spondylolisthesis. So I basically have two fractures in my spine that I'm guessing were from my growth, crappy nutrition we talked about, and then probably in the weight room mixed with my sports.
And
so
degenerative indicating that this was a process that played out over time.
Yeah.
While your spine was getting larger, you put a lot of undue stress on it, potentially from improper lifting form, didn't have that guidance in the weight room, trying to keep up with the seniors and impress other people, etc. And that led to just repetitive stress on some of the posterior elements of your spine, especially the low back. So you kind of develop this chronic low back pain.
Right.
That we're you're probably feeling some of those effects nowadays.
Absolutely.
Aren't you?
Absolutely.
Even, a decade and a half later.
Yeah, exactly.
So,
but now like the difference is I have the training and I have the knowledge of like what it should feel like in my body. And so that's the story I tell all day long in my treatment room when I have these kids in my treatment room is, hey man, I've been in your position. Like, I know what it feels like to be hurt. I know what it feels like to have crazy low back pain. Like, there's a light at the end of the tunnel. And I think that's the message I continue to tell myself. And so that's, I guess, what I would go back and tell myself. Hey man, I know you're going through this. This is a process. It's going to get better. You just need the right environment to make it get better.
And we had another guest on our podcast previously, Dr. Richard Ulm, and we really dove a little bit into optimal stabilization strategies, et cetera, for the weight room, optimal joint centration around the back, and how do we stabilize the back for those lifts. And he's with Athlete Enhancement. I really recommend people go check out some of his wonderful educational content there. So far we've got, nutrition, maybe stick with more of those whole foods. Where are we getting these important carbohydrates from is going to have an effect on not only your performance in the weight room, but if we look at, the glucose spikes that are associated with those 2 donuts in the morning. I mean, I basically slept through half of high school.
Same.
Because you get up really early. For us, it was 6:30 a.m. We'd go for a run, get back in, have a couple Pop-Tarts. Those first couple classes, you're pretty amped up and ready to go. And then by the time lunch and that 1 or 2 o'clock rolls around, you have that just huge crash.
Yeah.
And that's something that I was experiencing even in chiropractic school because I was such a carb freak, I just need to get the carbs in for the energy. Right. And then, lunchtime rolls around. I need more carbs for more energy, have that quick spike in energy, and then have that depression afterwards.
Right.
And that would result in like attention problems.
Yes.
And it would result in me not being able to be as studious as I could have been. And I probably would have been able to have performed better, not only on the field, but in the classroom too.
That's right.
So,
which it has huge implications later on. I mean, that's what I keep telling kids too, is like athletics is an awesome avenue to get what you want out of life. But you also have to think about your future. Like if you get good grades in school, you get scholarships. If you get scholarships, you could maybe get on an athletic team that you maybe wouldn't be able to. So like little things like that, like if you have good academics, you made a joke yesterday that the only reason you were on the cross country team at Adams State is because your GPA was going up. But that's not 100% true. But I mean, those little things matter. And athletics is an awesome thing. And I'm obsessed with sports. I love it to death. But at the end of the day, we got to have a career at some point. So, that'd be another advice I would give my younger self is like, hey, dude, you need to figure this out because you're going to have a life to live after this.
Yeah. And it'd be great if we could all become professional athletes and get those big old paychecks that we hear about, those massive contracts. But at the end of the day, the number of doors that you have open to you is going to decrease if you have poor academics.
That's right.
So just keeping those doors open and having something else that you're psyched on. I mean, this kind of goes to the mental thing,
right?
Because when I was in high school, I felt like I was just sacrificing so much to become a really good runner, right? I was sacrificing all of my social life. I would tell myself that I'm sacrificing my academics for running when really I was kind of just being lazy, right? I just didn't want to get the heads down working, right?
That's right.
But if we do keep those doors open, that really is great for us later on. And I think that having something outside of our sports too is really great mentally to help us recharge and be re-psyched and motivated when we are at practice and we are grinding out all of these sets and reps, or for me, trials of miles when I was in high school. And you don't get that quite like crushing feeling if you do experience a failure, which failure is important in learning how to fail is so important. So yeah, I love that we kind of circled to that mental side.
Yeah, of course.
No one talks about that.
That's right. That's right. Yeah.
So nutrition, important.
Yeah. Training,
important. Listening to and trusting your coach. No matter what we say on here, just trusting your coach is the most important thing. Because that's what's going to give you the optimum performance, is listening to what they say and then doing it. Now, what about sleep? I remember there was a reason I was sleeping in class.
Yeah.
And that's because I was watching TV, staying up late, and I had trouble falling asleep. And then I got to get up at 5:45 to drive to school and have that 6:30 a.m. practice. So what kind of remarks do you have on sleep?
Yeah, I had a horrible sleep schedule too. You ever heard of a PlayStation? My God, I think that was put on Earth to just distract people like us. But I'm the same way. Yeah, I was up late, up early. I was pretty good about getting 8 hours. But looking back, I also, just because my nutrition was so poor, my genetic predispositions, I just didn't sleep good. I remember I never had dreams. I never actually had deep sleep. I still struggle with it today, on and off, if I don't really, concentrate on it. So, but yeah, my goodness, even especially in a growing kids, like we say 8 hours, but you could push up to 9-10 hours and not be crazy with this. So, but also your nutrition affects that so much. Like I always tell the stories, like if you have gut bombs every night before you go to bed, you're going to wake up at 3 a.m. because you have literally a colon ghost in your stomach that is wanting to escape. And so, little things like that make a huge difference. And so every year I talk to the football team and a couple other teams at Troy. And those are the stories I'm trying to tell. Like, yes, you're runners. You're taught to carb load before a race, right? The night before. But can we not be a little bit more creative with carb loading than just having giant pasta Alfredo?
Oh my gosh.
It's like that. It's like the Office with Michael. He's getting ready to run the 5K.
10 minutes before his 5Ks, big old plate of fettuccine Alfredo, right?
Right. And so I show that video on all my presentations because it's not that crazy. People are actually doing that. I remember our pregame meals for football were pizza.
Yeah, baby.
I'm like, looking back, like, what in the hell? Pizza and soda.
Yeah. Oh, and remarking on soda, if it was 7 p.m. and I handed this high school athlete a half a cup of coffee, you'd be like, you're insane.
Yeah.
What is in Mountain Dew, Coca-Cola, all this stuff? 70 milligrams of caffeine, which is akin to almost an entire cup of coffee.
That's right. Not only that, and you got 100 milligrams of sugar. So, my goodness, the glucose spike is insane. So, I think just, again, going back to the nutrition piece, I'm big on nutrition. If you can't tell, like that's going to be a big story
swept under the rug every time.
Right. And I just think that always affects sleep. And so also too, like anxiety, I think is a big thing with our high school athletes, especially if they're starting to learn how to compete. They're starting to learn how to fail. They're on these big stages. So this underlying anxiety that can be made worse by the things that we're ingesting.
Definitely.
So now if you have this vicious cycle, you're eating like shit and you have anxiety. Then you have anxiety because you are nervous about your performance. Then you're nervous about your performance and have anxiety. So now you're eating more crap. And now it's just this vicious whirlwind.
Yeah.
So then, I mean, we haven't even talked about musculoskeletal yet, but now you can imagine if we have this giant inflammatory storm inside of us, and then we go to compete, our tendons and our ligaments don't have the nutrition in order to repair and recover. Yeah. So now we're kind of really telling the story of how this all kind of happens. And I mean, the tough part is managing it. Like that is, we're picking off a huge chunk here to try to manage all of these things in these athletes' life. And we may only get 30 minutes with them twice a week. So like, it's hard to get this, hard to get it all in, that's where, you guys are doing a great job, and this is kind of like your crusade. And for me, how I do it in high school is I try to get in those preseason meetings. Yeah. Try to keep talking to the coaches about the importance. Try to tell, keep sending them things. We're all friends on Twitter. Like Twitter is big in high school now. So if Andrew Huberman or someone posts something on Twitter that's like easy to digest and really kind of drives on the point, I just DM it to all of the coaches in Troy. I just have a folder in my Twitter that goes to all of those coaches. And if they read it and they listen to it, awesome. If not, it's no big deal. I just want to be able to keep giving them information that hopefully they can transition to their players. Because it goes back to what you said, trusting your coach. So the coach is going to be the one that actually, tells the story. Our goal is probably, my goal at least, is to give them the materials to tell the story.
Yeah. So, and we're going to talk about management a little bit later, but I'd say one of the toughest things is when you have an athlete come in and you're treating them for a musculoskeletal issue, whether that be a tendinopathy or Sever's or whatever, and we're doing the best that we can, but in the back of our mind, we're like, man, how is this kid sleep? What is this kid's nutrition like? Is he waking up to 2 donuts a day and then going to sleep with a soda on his bedside table, right? Right. So now let's transition a little bit. You talked about some of the coaches in your area, and I know you guys work very closely, not only with the athletic trainer at the high school, who is a stud, Brandon, right?
Yep.
I remember he's super high quality athletic trainer, and having you guys in the weight room with them in those preseason meetings, it's one of those kind of really great systems where we're able to go out and source all of this knowledge and then distill it down into practical pieces for coaches. Right. Not every coach has access to studs like you guys. So what kind of advice can we give to coaches regarding things like programming? What things do you see? What kind of themes do you see as far as maybe the etiology or predisposing some of our athletes to injury, whether that be the risk to reward ratio with what we're doing in the gym, et cetera?
Yeah, the risk reward is a huge thing to me. I think that's the story I try to tell the coaches of. Just take a bird's eye view. Like, ask yourself, is it really worth it? But I think it also comes down to just overall load. Like throughout the week, and the coaches in Troy are doing a great job. We've really had great meetings and getting there. But I think just take your program for that week and just really look at it and say, how much load are these kids actually under? It's awesome. You need your maxes to go up. We have a board. It's the 1,000-pound club at Troy. Like kids go, that's their goal. That's what they want. But, if you have a kid that's, 165 pounds that is injury prone or has, had past injuries that have kept him out of games and stuff, is it really worth it to push him to that 1,000-pound club?
Yeah. And that was 1,000 pounds split up into between 4 different lifts, right?
Yeah, squat, deadlift, hang clean, and bench press.
Yeah.
And so between those 4, which, I mean, that's totally doable. That's a great goal. I'm not saying that you shouldn't. It's, again, you just need to ask your questions about the individual. The hard part is, like Troy in their preseason football workouts, they had 135 kids there. So could you imagine, it's a predicament for the coaches. You may have 6 coaches for 130 kids.
Yeah.
It's awesome that the participation is there, but now you're just creating a war of attrition. It's almost like the CrossFit games. One of our mentors, Brett, he always says, you see perfect, awesome people in the CrossFit games because it's attrition. If you can't handle the load throughout that time, you're not going to make it to that standpoint.
Throw a bunch of eggs against the wall. The ones that don't crack are the ones that make it, right?
Exactly.
Yeah.
Which is happening in our high schools and in our junior highs.
Oh my gosh, yeah.
Because they don't have the time or the manpower to teach proper form, to actually go through and and then you have this weird urge if you're a underclassman, that if you are feeling symptoms, well, I got to keep going. I got to keep lifting because otherwise, I'm not going to play, or maybe the coach is going to think differently, or the upperclassmen. So like again with this vicious cycle. So I think that like overall load, if we could just take some time to look at the overall load and get creative with how we're loading these kids.
Yeah.
Maybe start working on speed training on off days that you're not working on straight strength. Just like adding in little things like that, I think can go a long distance with our kids.
Load and the multiplier of load, intensity too,
Exactly.
right? Yeah. Which we both know, you increase both of those variables at the same time. Talk about increasing that injury risk,
That's right. That's right.
And a lot of times, we'll have people come into the office, I'll have athletes come in who are sort of weekend warrior-esque or something like that. And you're like, okay, so what kind of stuff did you do the last week? And you see both of those variables got cranked up, and it's like, well, I had Saturday off, so I did, where I live in Summit County, you might have someone do 3 sports in a day.
Right.
They might skin up the mountain and then ski down, and then they might go to the weight room afterwards and then go to the climbing gym after that. And they're like, oh yeah, and then I'm having this like thing going on. It's
right.
Like,
yeah.
Oh yeah. How could you not?
Or how about this in St. Louis? Yeah, right now I have kids that are playing soccer, playing baseball, and running track on the same weekend.
Oh, man.
So you may play 3 soccer games in the morning, go catch your baseball game or 2, and then the next morning you have a track meet. And I mean, these are 12, 13-year-old kids, which is, I mean, if you just think about it, we were lucky enough to sit down with James Andrews. And that is like the story that James Andrews, if you don't know who he is, he's probably the most famous orthopedic surgeon in the world. And that's the story that he's trying to get out too, is like, it's ridiculous that we're playing 3 sports at once right now. Mm-hmm. I get it. You want your kid to have opportunities when it comes to high school and, hopefully into college and stuff like that. But can we just like take a step back and just, take a second, give your kid a breath? Yeah. You don't need to be playing 3 sports on a weekend.
Yeah. That bird's eye view is such a prescient idea. Mm-hmm. Don't lose the forest through the trees. Exactly. Right. It's like, no, your kid, I'm sorry, but like they don't need to be playing all of these sports every single day. Mm-hmm. Like let's dial it down and maybe have some real seasons where maybe we're doing track in the spring, soccer in the fall. I mean, that's a great combo right there.
Awesome. And it's not that I don't want kids to play sport. I want them to. I want them to be outside, to be doing these things that they love. I just think it's ridiculous to play 10 games in a weekend.
Yeah, and I love that you mentioned James Andrews because James Andrews, world famous orthopedic surgeon. You guys had him on your podcast, which we'll definitely point people to for amazing information later on. Gestalt education, if I forget that. But he's talking about how he is literally operating on 12 and 13-year-olds who either tear their ACL, tear their UCL in the elbow, etc. And he's really attributing a lot of this to too much participation, too much practice time that's scheduled, and you're pushing these kids to their limit. And it's like, man, let's let these kids be kids a little bit,
Which takes us back to what we were talking about the weight room. We were talking to look at your week and your overall load.
Yeah.
You should do that with your own kids. Mm-hmm. Like if you just look at your schedule, like, oh crap, like he's got practice every single day this week, 2 practices some nights, and then we're going to play 10 games this weekend. Maybe let's just take it easy. Like let's reevaluate where we're at, risk reward, right? Mm-hmm. Then if we take it back to the weight room, like I was telling you a story before we got on about I had a senior outside linebacker hang cleaning. It was like week 2 of the season, working on his max of a hang clean, catches it wrong on his wrist, fractures his wrist, pins in it, misses the whole season.
Yeah.
Great example of, was it really worth it to max out on that day in order to get a couple extra pounds?
Missing a senior year too,
exactly,
right?
Exactly. So, and again, it's not that you shouldn't be lifting weights and lifting heavy during the season. That I 100% think that's great. There's a great research out about consistent load on your tendons and your ligaments, creating resiliency. Yeah. But at the same time, like, just let's take a step back and be smart about it. Mm-hmm. Is it really worth it? That's what I want the coaches to keep asking themselves.
Yeah. And I'd say if you're a parent or a coach, just look back on your childhood. Mm-hmm. Were you playing 4 different sports and an instrument and, having 3 hours of homework every night and all this stuff? And the answer, by and large, is no.
Right.
And think about yourself when you were 12 or 13. Would you put yourself through that?
Yeah, exactly.
And it's like, oh, well, probably not.
Yeah, no.
And it's like, okay, so you're going to put your kid through that. And now we see on the clinical side the manifestations of overloading these kids. We see a lot of burnout. We see a lot of these injuries. And then, we're telling these kids, oh, you got to be tough.
Right.
You got to play through this injury or else you're weak, right?
Yep.
And, a lot of times we can play through these things. And for me, I did the same thing. I didn't really want to tell people about some of my injuries when they were cropping up. And then it's like, oh, wow, I guess I can see why I had 2 tibial stress fractures when I was in high school,
Here's the thing I see at least once a day. We call them double Ds, dumbass dads that walk in with their kid. You have a 13-year-old with elbow pain, and he's asking me if he can pitch this weekend.
Yeah.
So the story that we always tell is, dude, if you're a Major League Baseball player right now and you have medial elbow pain, you're on the DL for 6 weeks, period. No questions asked.
Yep.
So are you saying that your 13-year-old should be treated differently than our Major League Baseball players?
Yeah. And this isn't the Little League World Series.
Exactly.
This is the weekend tournament for, maybe select ball, maybe regular club play, whatever. And we're just shoving these kids in, telling them be tough, and potentially leading to the things that we talked about earlier, writing James Andrews checks, right?
Exactly. Anxiety,
which he deserves it, right?
Yeah,
because he's amazing,
sure.
But he doesn't want to be doing UCL, Tommy John surgeries on 12 and 13-year-olds.
No way.
And one thing that I really keyed into when he was talking on y'all's podcast was, take one of these kids and give them a season-ending injury while they're developing musculoskeletally. So while their growth plates are still active, while their long bones are forming, take them out of all sport participation, take them out of their social group for 6 months to a year. Because sometimes people are like, well, the surgeries are really good, so they'll be fine afterwards. But you're really creating this void in their sport participation, in their social participation for 8 to 12 months in the least. As a result of getting these surgeries. I mean, I remember, being on the bike in the training room, not being able to hang out with my teammates because of a stress fracture, coming back as fast as I could, running a good time, being part of the team again. Guess what happened?
Another stress fracture.
Other side, baby. Got to even it out,
That's right. No, and that's the difficulties I think that now you and I are transitioning into is making those decisions. I'm sure we'll talk about return to play, but those are the hardest decisions that we have to make because we've got to try to prevent that. As much as I need a reputation for getting kids back on the field, I need a reputation for not re-injuring them. That is a fine line, and that's nobody really knows, what that actual is, or there's no guarantees is what I'm trying to say. Yeah. But those are the hard decisions that we got to continue to make. So.
Yeah. How do we get what we want, which is playing, while also giving people what they need, which is the optimal rest, the optimal rehabilitation strategies to safely return to play. Right. Because, honestly, I don't care about your kids. He's 13 years old. He's got a baseball tournament this weekend. I care about your kid's longevity and not losing the forest through the trees, having that bird's eye view. I want your kid to play in high school. I want your kid to play his senior year. I want them to play in college and have good positive experiences with sports participation, learning how to fail, being with their friends, learning culture and community through those things so that then they can learn life lessons for the rest of their life and not just to grit their teeth through this one weekend game and then get hurt and learn what it's like to get surgery at a young age.
Right. Well, and that takes us back to the coaches. That's how we kind of got on this rant was that I try to talk to the coaches all day long about the thing I say all the time is I'm his or her best chance at getting back. And what I mean by that is, yes, I'm very confident in my abilities to treat the patient, but I'm also very confident in my abilities to not blow them up down the road. Yeah. And so it's a delicate balance of the coach because the coach, they're graded on wins and losses. Unfortunately, that is just the reality of sports. But so if their star player can't play in the next game, that sucks. But we got to be able to, like, again, zoom out a little bit and say, okay, it's the 4th game of the year. It's a great team. The goal is to win a state championship. So then we need to make the right decision now. That way we can get there at the end of the year.
Yeah.
So,
and don't get me wrong, little tweaks, little aches and pains. I'm like, yeah, I mean, he's fine,
Sure.
But if it's something like medial elbow pain in a pitcher and they're about to go pitch, throw a 5-ounce ball 100 times as hard as they can.
Yeah.
These are the things where we're giving advice for sitting a kid for a specific reason.
That's exactly right.
Maybe have them play first base, Like these things, we can modify load and still have them participate, have them progress in skill development, but not do something that might injure them down the road.
Right. I think if I could just close the thought, as far as coaches, my advice for coaches too would be find someone you trust healthcare wise.
Yes. So,
and obviously we're always looking for patients. That's what we would love to do. That's what pays our bills. We need more patients, but reach out to people in your area for advice. I guarantee I have 3 or 4 text messages from our coaches in Troy asking, hey, I'm thinking about adding this into programming. And how I got to that point is I literally just hung out with them. I didn't go in there guns blazing. I'm the best in the world. It was just, hey, do you want to go get a drink sometime, or do you want to go get coffee? Yeah. Or, hey, do you have any questions? I don't know. I'm bored today. Do you want me to work on you? Offering to treat them for free, little things like that. I think if you can build that relationship with the healthcare personnel that you trust, they can make the hard decisions for you.
Yeah.
You don't have to be, the coach doesn't have to make the decision to sit a kid or to play a kid through it. You can lean on us because at the end of the day, it's our ass that is on the line, not you. You can wash your hands of that and say, sorry, he said no, I got to trust him. Or he said push through, let's push through.
Yeah, I think that's such a great point for coaches to have that person who has done the heads down work, who has spent years and years, and now it is their life mission to help out with these types of injuries, and have that person to play on and ask advice from. For something that, maybe you're very knowledgeable on the topic. I know many coaches are extremely knowledgeable, do great jobs with programming. Yeah. But when it comes to like the management of injuries and having an issue or a problem, having more eyes on a problem is always better. Having information from someone who can have that bird's eye view can be so helpful, because at the end of the day, yeah, sure, some things are about wins and losses, but at the end of the day, our goal and all of our coaches' goals is to fit the needs of the kids and help them be the best they can be, not only athletically, but also in their overall lives.
Right.
Because that's really what sports at a young age are really very much about, in my opinion, is learning those life lessons.
That's right.
So now let's transition more to our clinical stuff, the stuff that, our wheelhouse, right?
Yeah, that's right, baby.
What kind of themes do you see injury-wise, and who are the repeat offenders here? So for me, something that sticks out are the ankle sprains, some of the same muscle strains. What are the things that you're seeing kind of over and over, and maybe this happens once, and then it predisposes that athlete to more of that same injury, and now we're dealing with a chronic issue which nobody wants to deal with.
Right. Well, I mean, at the end of the day, we talked about at the beginning, the only predictor of injury is previous injury, right? That's the only evidence-based, tried and true.
Yeah.
That's it, right? Well, I don't necessarily 100% buy into that. I think that we can get a little bit more specific, in that. And so the things I see are that, like a kid shows up with an acute ankle sprain, because that's kind of what I'm known for in my area. And then once you start to unpack it, everything starts coming out. Oh, well, I did have Osgood-Schlatters growing up, or, oh, my low back is kind of stiff. Like I'm always kind of like popping my back and things like that. Or, I get headaches and stomach aches, like little things like that just like once you start to unravel, it kind of makes sense. Yeah, there's a trauma that happened. You take a 3-pointer, you cut down on someone's foot, and boom, you got an ankle sprain. But what I'm more concerned about by gathering that information is honestly how far is this going to take? Like, how long is this going to actually take to take care of this situation? So that'd be one. And then 2, I guarantee Rich talked about like open scissor positioning in the low back.
Yeah.
What's the one thing every high school kid gets taught? You want a 6-pack and you want cut chest and arms, right? And so all day long, I'm trying to convince these kids to stop sucking their stomachs in. for multiple reasons. One, because it's terrible for your low back. Stu McGill, he's the most researched low back and guy. He says, if you show me a six pack, I'll show you low back dysfunction. Now, it's not to say you can't look good with your shirt off and stuff like that. It just means that we can't have us constantly having tension in our abdominal wall. So like that is the number one thing I think, that as far as if I could shout from a mountaintop that I think would change a lot of these like chronic stuff or even acute injuries, especially in the weight room or like non-contact stuff, as crazy as it sounds, stop sucking your stomach in. Like it has consequences distally so far, and I think it plays a huge factor in the recruitment of our muscles around our hip, which we know is very, very important for predicting knee injuries, especially non-contact ACLs. Tim Hewitt talks about the number one test that he would do to screen out ACL ruptures is just a drop test, meaning you just go from a box, you fall down and see how you land with your foot. Yeah. So like little things like that, I think are the things that I consistently see. A laundry list of other mini things or minimal things that are kind of adding into this big blow up.
So as clinicians, we've got to be watching our athletes move, and we've got to be kind of screening them and just see, okay, let's say we do that 6-inch drop down test. Yeah. They hop down, we look for a dynamic collapse at the knees. And then maybe we give them a cue, okay, can you do that without your knees caving in? And many athletes can. So in that case, okay, well, do that, Right. Land softly. Don't sound like an elephant being dropped out of a helicopter.
Yeah.
And land a little bit softer. Don't let those knees cave in. But then you also have the athlete population that cannot disallow that knee cave in. And then we go, okay, now do we need to look at some strength in your hip, right? That's right. And, we could riff on biomechanics all day long, but no one would argue that someone is better off having a weak hip.
Yeah.
And whenever we're talking about the knee, that's like the classic metaphor are the three kids in the back seat, right?
Yep.
If that middle child, the one in the middle, starts to cry, we know it's probably not an isolated incident.
That's right.
It's probably somebody on the right or left that are poking or tugging on them that are making them cry. So we've got to be looking at the entire kinetic chain. We can't be isolationist, especially with what we do. So we've got to be looking at hip strength. We've got to be looking at the foot and ankle. We've got to be looking at some of their biomechanics, some of their form when they're doing that drop-down test. What other stuff have we because you've been kind of experimenting with some of these things at the high school, right?
Even just something as simple as ankle dorsiflexion. I mean, like that is, especially after an ankle sprain. Like how often do you see it? It's a mini ankle sprain, no big deal. They play the next day. They'd see nothing of it. But then 2 weeks later, they still have a massive loss of dorsiflexion, let's say on the right side.
With no pain.
No pain.
So,
we know the consequences of that. More than likely, they're not going to hurt their right side of their body if it's on their right side. Like the opposite side is going to take the brunt of all this stuff because it can't dissipate force through that ankle.
Yeah.
So I think like little things like that. Like if I get an athlete on the table, I'm checking their whole body for stuff. I'm making dang sure that their ankles are moving well. Even their spine is moving well. They don't have it sucked in stomach. They don't have these isolated trigger points and things like that. So I think that, and then I think just not understanding the nutrition part. I know we keep coming back to this, but man, oh man, like you get an ankle sprain and then you go to the orthopedist, you're in a boot and crutches for 6 weeks. And in that meantime, you're not working out, you're eating like crap because you're sad and depressed and your ankle hurts, or you're popping ibuprofen like it's candy, like all these things add up to then now, you come back from that boot, you didn't do any rehab, you go out on the soccer field, boom, non-contact ACL rupture.
Yeah, and one thing that previously was thought to be the best thing for recovering from these injuries was the RICE protocol, right? Rest, ice, compression, and elevation.
Yep.
Right, which we now know has no benefit over just walking around.
Exactly. Early weight bearing, number one predictor of return to play in ankle injuries.
Yeah,
and I would bet if they did that same study with the knee and hip, we would find the same thing.
Yeah.
Joints love load. I mean, that's just, especially tendons and ligaments. They love load. It just needs to be controlled load, and it's got to be in the right time frame. Yeah. So I think those are all big things.
Yeah. What is going to accelerate tissue healing? What is going to accelerate the extraction of inflammatory cytokines from that area? That's right. The edema and swelling, moving.
Yeah.
Motion is lotion. The skeletal muscle pump, getting that lymphatic fluid out, that's going to be so much more effective if they're able to weight bear. But that's where someone like you or I comes into play, and we say, can you walk on this without too much discomfort?
Yeah.
Do you have lingering discomfort afterwards? We're there to ask the important questions on if you're able to weight bear and how you should weight bear, kind of like loading protocols, et cetera. And then coupling that nutritional piece. I know I'm a big proponent of collagen supplementation.
Yeah.
So we've been talking about...
You got me on that when you were an intern at the office.
Yeah.
45 minutes before, is that still the number?
I do think 45 minutes before. There have been other studies which just, they put in like 5 grams like in their coffee in the morning. Sure. Maybe not in the kids' coffee.
Yeah.
Maybe they're not drinking coffee yet.
Right.
But they will at some point.
Yeah,
right?
yeah, for sure.
So even in studies where someone's doing 5 grams of collagen in their coffee in the morning, I know I kind of talk crap to you because that's kind of what you were doing.
Yeah.
But those studies show decreases in activity-related knee pain. They show decreases in ankle pain and also increases in just that baseline foundation of protein.
Yeah, beautiful.
Which we've talked about carbohydrates. And we talked about how everybody's really big into carbohydrates, especially me as an endurance athlete.
Right.
But the protein piece is also so important.
That's right.
And what I love about collagen is it's those specific amino acids necessary for collagen to be formed.
Right.
So protein is just an umbrella term for amino acids, right? And if we're trying to increase collagen proliferation, in that case, you want to have the specific amino acids for collagen proliferation.
Beautiful.
So in many of these tendon ligament injuries and even muscle strain injuries and honestly, even bone injuries, because everybody knows like calcium hydroxyapatite crystal is one of the major components of bone. It's that hard, inelastic component of bone, but our bones, especially when we're younger, also collagen.
Yeah.
That's why they'll have those bending green stick fractures.
Right.
And that's why they don't break like a stick of chalk. Like if we went and, messed up and made some bad decisions on the ski hill, our fractures would look really different because now we're a higher proportion of calcium hydroxyapatite crystal versus collagen. So even in like a stress fracture population, I'm looking at this thin, wiry, sinewy kid and I'm telling their parent, I need you to take some collagen.
Right.
I need you to make sure you're getting that protein baseline. The 45 minutes before, I think, a lot of like Keith Barr's research has done that, has looked into this for increasing that collagen content that's circulating in the bloodstream when you're doing loading, which we know tendons and ligaments, these things that are commonly injured in ankle sprains and endurance athletes, they don't get a direct blood supply.
Sure.
There's not an artery directly feeding this thing. They imbibe these nutrients from the fluid and things circulating around them. So if we're thinking about, giving them the best environment to absorb that load, doing it 45 minutes before might be a better way or more optimal way to do that.
I love it. I implement that all the time because of you. So that's awesome. The ice thing. One thing I wanted to mention is that you asked about us like experimenting, like the things I've seen in the last couple of years.
I know where you're going with this. Please, yeah.
Yeah. So like I've completely taken away ice from Troy as literally an experiment. Okay, so no athlete in Troy gets ice. Especially if I'm around, some might slip through the cracks, but just to see, what would happen. Nobody's missed it.
Yeah,
recovery is great. We actually now started implementing heat. So like all the baseball kids after practice, they heat their shoulders and elbows.
Do some mobility drills.
Exactly. Football, same thing. Everybody heats everything. Again, just as a case study. I have no research to 100% back it. I just as a case study.
And this is not an unsafe thing. This is not an unethical thing. There's no data to support ice for recovering faster.
Exactly.
It's not like this kid's ankle sprain is not going to get better. There's no research to actually support ice.
Right.
So no, we're not being unethical by doing this experimentation. Go on. Sorry.
Yeah. So I mean, like my return to plays are faster. Kids are feeling better. Swelling is going down faster. Like all of these things are changing, which is so cool. But now, like, it's almost like it's a joke at Troy. You know, everybody's just like, instead of people walking in and asking for an ice pack, has anybody got a heating pad? You know, so like little things like that, I think have made a big difference, and it's kind of changed the culture of the training room and of Troy and Silex, which I think is so awesome. That now we're using heat more often and getting great results with it. So
I tell you what, I was also one of those people that was icing something every night.
Yep.
I had that classic like little blue ice pack thing. You put the ice in, a little bit of water in, you screw the top on. I was icing something almost every single night. And I tell you what, I never once woke up the next day and went, wow, I'm glad I iced that. I feel so much better.
Exactly. But my kids with like ankle sprains and stuff, like they feel so much better after that heat. So the other thing that we've been messing around with too is slowing down on white athletic tape. So this is kind of a controversial topic, but I loved having the conversation. There's some decent studies out about it that are talking about like the stretch response afterwards. The one that I always quote is, and I can't remember who it was, but they looked at, for ankle mobility, they looked at an air cast, which is the most simplest thing that you can ever get. Basically restricts no mobility.
Immobilization boot, basically.
Exactly. So an air cast, white athletic tape, and then the last one was just a control group. They actually found that after 10 minutes, the white athletic tape lost 50% of its restricted range of motion, and the air cast actually lasted longer. Meaning, if you just wore a crappy ankle brace from Walmart, you actually restrict range of motion longer than with the white athletic tape. So it doesn't discount, whatever, if it feels good. You know, like the mental side of it, the placebo side of it, the kid loves to get this ankle tape. I'm not going to be a douche and say that.
They feel more secure with that.
Exactly. Yeah. But we've been messing around with kinesiology tape.
Yeah.
And again, this is also controversial, but I still believe that you can restrict range of motion with kinesiology tape, whether that be through the afferents, whether that be through actual restriction of range of motion. Yeah. But we've been getting good results with that too. Now, there's a little bit of a cost associated with that. It's a little bit more expensive to do, kinesiology taping and stuff like that. But for my kids with post ankle sprains, when they're returning to play, we don't do white athletic tape. We do a kinesiology tape with a leuko tape over the top.
Yeah,
and having great results. So.
Well, I mean, talking about stiffness and holding that stiffness in the tape, white athletic tape. I mean, I've used it on my fingers for climbing, and I can feel that stretch that you're talking about after 1 to 2 climbing routes. Right. And I used to get my Achilles taped all the time. I've had my Achilles taped every single which way under the sun.
Right.
And I tell you what, that white athletic tape, it loses everything. Yeah.
Yeah, it does.
But you put that leuko tape on there, and it's like, we better be kind of careful with this because we know this is not going to change.
Exactly. The guy that started using leuko tape was Tim Brown. So before kinesiology tape was even here, he was in the 80s or 90s, and he was working with surfers, like in California. And so these dudes are crazy. Like, the surfers don't get enough credit for how crazy they are. Like, snowboards the same way. Like, they'll separate their AC joint on a wave and, or dislocate their shoulder, and they're trying to get back out there.
Paddle back out there.
Exactly. And so Tim was using leuko tape on skin to basically help restrict range of motion in these guys with these crazy injuries. And so then he started messing around with pulling on it and doing different fascial pulls and tabs and stuff like that. And so, my mentor, Greg Dorr, and Tim Brown have kind of pioneered that, and we get some awesome results with it. So,
and I've taken what you taught me on that, and I've used it in clinic, and wow, the results that you can get, and the weird pain relief that you can get with it
doesn't make any sense.
It doesn't make sense, but I tell you what, it works. So if you're trying to get that kid to safely return back to play without nociceptive input, which we know is going to alter their movement patterns, alter their biomechanics, even if we do artificial bringing about of pain, that's going to change their biomechanics, change their movement patterns.
Right.
So if it is someone where, let's say it is a high-level game, and we know this isn't necessarily something that's going to get much worse, our risk here is fairly low, and we just want that kid to play, we can decrease their pain pretty well with some of the correct taping techniques and give them that psychological security as well.
Right. Which I think brings up a good point of like big games. Those are decisions that I'm making at Troy a lot of times. If it's a state championship tomorrow and I have a kid with an acute ankle sprain, I'm probably going to do something to help him play tomorrow. I mean, we talked about the whole purpose of playing sports is wins and losses, and like to take that, to have that taken away from you the day before would be tough, or, that week leading up. And so sometimes like we're making hard decisions on whether or not we can get a kid to play or things like that, or whether or not it's going to have long-term effects. And a lot of times, honestly, the thing that I've found so successful is I'm just very upfront with the parents and the athlete and the coach, honestly. Like, and that looks like sitting down and actually explaining risks. Like we talk about informed consent, but rarely do we actually go through pure informed consent. But in those cases, I do, partially because I'm trying to, not get myself in trouble or anything like that, or my license, but also just so they understand. A prime example, we're in the Final Four for basketball. This is a month ago. Star player, our best kid on the team, takes an elbow to the face, knocks out, concussion, minute into the game. Automatically, I can feel the eyes, on me, because I'm there. Me and Brandon, so we go out there. He's got a headache. We take him off. A headache is relieved after a couple minutes. He answers all of our questions, passes all the return to play of a concussion. Literally everything looks great. So at that point, we make the decision with him, his coach, and then the parents, hey, we're going to let him go out. He passed everything, no big deal. Couple minutes go by, he goes into the game, he shoots a three from literally almost half court. He's run to the wrong side of the plays. We're like, holy crap, what happened? Pull him out. Sure enough, raging concussion. Now all of his symptoms come back. Scary situation. End up taking to the ER, get a CT, everything was fine. But like that was a decision that we had to make. He's a senior. It's a state championship. Like, he passed all of our tests. If it was just a normal game, yeah, I probably wouldn't have went back there. But we decided to take the risk and let him back out there, and it kind of got pushed back into our face, pie back in our face. But it was a great learning experience for me, because you start to understand the etiology of concussions a little bit more. And the parents were so thankful that I took the time to explain everything to them. I went to the ER with them. I explained everything to the nurse, like all these little things. And now like I get texts all the time like, hey, I just wanted you to know I'm so thankful that you were there that day. Like, I'm so thankful. And so being open and honest with your athletes, your coaches, and your families is so important, especially like if you're a provider trying to grow a practice of athletes. The more open you can be, the better. And if you don't feel like comfortable in a situation, just point it out. Just point it out and say, this is my expertise. This is what I think should happen. Here's everything. And then it's up to them to make the final decision. So. Yeah.
I mean, thorough education, and then letting them have that informed decision-making process and not getting in the way of that, because at the end of the day, it's their kid. If it's the athlete, it's their body, etc. So giving them, these would be the pros, these would be the cons. These are the things that we have to watch out for.
Right.
And it's like, oh, we saw some red flag things. Get that kid out of there immediately.
Right.
And making those decisions and knowing, hey, buddy, it's not your decision anymore.
Yeah, it's mine.
Yeah.
You're done.
It's like, and now we're going to do all of our due diligence in making sure, getting some imaging, making sure nothing pathological is occurring.
Right.
Oh, well, this has been really awesome. And now to wrap up, Taylor, the old saying is an ounce of prevention is worth a pound of cure, right?
That's right.
Nice classic Ben Franklin.
That is exactly, that's right.
So if you had to talk maybe to previous Taylor or to all high school athletes, what is your ounce of prevention that is going to be worth a pound of cure down the road for maybe your high school athletes at Troy and high school athletes everywhere?
I think everything we talked about, to sum it up, try to eat good. Damn it. I mean, you don't have to be perfect, but like, just understand that the things you put in your body are either fuel or bad, that thing I think to me is the most important. And if you don't feel good, keep telling people. I think that's the end of the day. Don't be afraid to say that, hey, my stomach is killing me.
Don't be afraid to get help.
Exactly. Because at the end of the day, like, nobody's going to shame you for feeling, trying to seek help, and keep looking out. There's so many good resources online. Injury prevention, that was a shoulder plug for you, but great information online. Keep researching, do your own research, listen to your body. Don't let other people tell you that, oh, you can push through it, and stuff like that. If you don't think you can, be the first to speak up, because I wish I would have. I wish I would have told my parents, "Hey, this isn't working. We need to find something different." And I know that they would have because they love me. I mean, they would have done whatever's possible, but I just didn't take the time, or we didn't take the time or due diligence to seek the right information, and the rest is history. And here I am today. So I think just take your body seriously. You only get one. And, take it seriously and think about the future when you're making these decisions.
Bird's eye view. Don't lose the forest of the trees. Have that grand scheme in place to say, what's going to help me with the longevity of my career.
That's right.
And my life.
Yep.
Because it's one thing to be paying for that little tweak on Saturday, and it's another thing to be paying for it when you're 30,
That's right.
in your 30s like us. And
That's
you're
exactly
like,
right.
yeah, I don't know if I want to go for this run today because I'm going to be paying my transgressions,
That's right. Yeah, exactly right. So,
all right. Well, Taylor, thank you so much. And where can people find more information from you guys? I know you've got the Gestalt Education Show. You guys do a ton of continuing education, bringing the world thought leaders into accessible areas for clinicians, coaches, etc., bringing amazing content. Where can people find you guys?
Yeah, so Gestalt Education is kind of that's our passion project, me and Brett Winchester. So it's gestaltedu.com, or on any social media platform, or just Gestalt Education. And then my personal stuff is everything is Dr. Taylor Premer. So Instagram and Twitter, kind of where I'm on. But if you guys have questions, or if you're interested in how I've kind of gotten in with high schools and anything like that, feel free to reach out to me. DMs on Instagram are the easiest way to get a hold of me, honestly. So
slide into your DMs.
That's right. That is exactly right. So, but yeah, then if you're a clinician, we'd love you to check out the Gestalt Education Show. We've had everyone from George Paletta, which is an orthopedic surgeon, to Michael Gervais, which is sports psychology. Nick Hedges is soon to be on there. Little things like that. And it's 100% free, and we literally do it for fun. So we drink wine on it. We travel all over the world and to interview people. So yeah, that's it.
All right, Taylor, this was a great conversation. Can't wait to have you on again, bud.
Amen.
This program is for informational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician with any questions you may have regarding a medical condition. Always consult with your physician before starting any exercises or doing anything contained in this program. Always stop if you experience any pain, discomfort, or difficulties performing anything described in this program.